Hello, I'm Fred Davis. I'm an instructor, an NMT instructor here at ASHA School of Massage. I've been practicing for about 22 years. Of that time, about 20 of it has been in what we consider the traditional medical community. So I have a good bit of experience in working with chronic pain type patients, people with significant injuries. What we're going to talk about today is a little bit of the thought process that goes behind NMT, and I'll give you a little bit of an example of how we look at the body and how we treat the body. You come over here. Shelton, could you bring that over? Have a seat. This is Shelton. What we're going to do is we're going to talk a little bit about forward head. So if you can bring your head forward just a little bit, you can see how his head is forward in space. See how the neck is coming forward here? What we're looking at in this position is a bilateral contraction of some of the muscles in the front of his neck. In this case, sternocleidomastoid and anterior scalene, as well as some diaphragm. Well, what I'm going to demonstrate to you today is the sternocleidomastoid work and some of the anterior scalene work that we would learn. So what we're looking at when we look at the body in general is you can see how everything is sort of rolled forward here. For Shelton, what that would do is that would show up as pain in the back of his neck or pain between his shoulder blades. However, where the pain is not necessarily where the problem is. If we go to where he's feeling the pain here in the back of his shoulders and the back of his neck, and we release that, what happens is these muscles relax and release, his head drops yet further forward. So in the short term, he may get some relief, but in the long term, it will make the problem worse. So we're looking at these muscles that have shortened, and as we release the neck and the pecs and the diaphragm, his body will do this, which is more what we're going for. After that, these muscles will relax on their own, and the pain problem will go away, hopefully with much more lasting results. Okay, can I get you on the table, Sheldon, please?
Sure.
Please. Thank you. Okay. Now, as I'm working here, I'm going to explain a little bit about what I'm doing and a little bit more about what neuromuscular therapy in general is. As you can see, or as you will be able to see, I'm lifting the muscle up and away from the neck, protecting the carotid artery, and tilting the head toward the side I'm working. You can see right here the shortening of this muscle bilaterally will pull the head forward and down. So what I'm doing is gentle compressions and manipulation compression to lengthen that muscle and help the neck move backward in space. Good. Is that tender for you? There you go, and you can see how I'm lifting the muscle into my hand, coming around and gently compressing it between finger and thumb. And then with manipulation, just gently sifting and working those fibers. Good. This work is particularly effective for people with chronic conditions and injuries. I came to this profession myself from a chronic pain background. While I was in the military, I had a spinal injury and lost the use of my legs. During my time in the hospital, I was helped by the military physical therapists. They gave me my legs back, but I was in a good bit of pain. During that time, or soon after I was released from the hospital, I went to see a neuromuscular therapist, and I got work on my back and neck, and my pain was reduced 60 or 70% from the work that she did with me. I like to say that the physical therapist gave me my legs back, but the NMT gave me my life back. For those of you who have ever lived your life in chronic pain, you know it's a pretty miserable existence. It changes everything about your personality. Okay, we're beginning to get some nice release here along the belly of the muscle, and you can see his head dropping back.